Hi, my name is Marian Reddick, and I'm going to be discussing memory loss when it comes to trauma. In this discussion, I'm going to talk about memory loss and how it relates to trauma, specifically impacting cognitive memory processes. First, I will begin with an overview of research that we've already kind of seen recently in the past few years, and then I'll go deeper into a study that I think would impact our mission of trying to understand the mechanism behind the memory loss in these trauma patients. So, in the past few years, research on memory loss due to trauma has been something of an ongoing increase. It's known that trauma can disrupt memory processes in different types of ways. So, post-traumatic stress disorder, which is PTSD, is the disorder that is related to trauma that is actually researched the most when it comes to memory loss. Those with PTSD could suffer from combat, childhood abuse, political violence, rape, even the Holocaust. And all these individuals experience these memory disturbances and something called declarative memory dysfunction. They may have intrusive thoughts and like hyperarousal, flashbacks, nightmare, intrusive thoughts, sleep disturbances, and then the memory loss and concentration. However, trauma-related memory loss is not just limited to individuals with PTSD. It's actually people with childhood abuse and just even one little trauma event. Memory loss can occur in these individuals as well. People who have experienced even chronic stress, low-level stress, low-level trauma, all experience memory loss. Providing services for these mental disorders that experience this memory loss is very important. And I think that's why the research that has been done and is continuing to be done is very important for individuals with trauma-related disorders. So the cognition of trauma-related memory is very complex. So for now, we really know that stress hormones like cortisol and norepinephrine play a really major role in memory processing. And so during these traumatic events, when cortisol and norepinephrine are at an all-time high, they disrupt hippocampus functioning, and therefore it affects the memory processes long-term and short-term. Another part of the brain that is also affected during these traumatic events is the amygdala. And the amygdala is responsible for that emotional processing center. And so whenever you're experiencing these really traumatic events, it spikes up the hormones in your amygdala, and you start to get a really big rush of emotions, and this can cause your memory impairments, such as memory errors, memory gaps, and just consolidating those memories in your brain in general. So other research indicates that the reoccurrent exposure to emotional stressors, even without that PTSD diagnosis, can cause like an increased synapse formation and dendritic growth in the amygdala. And also dendritic retraction in the hippocampus, and then finally anxiety-like behaviors in response to these specific triggers. Another mechanism that happens with people who experience trauma and memory loss shows that traumatic memories can become kind of stuck in that moment and in the memories of the event. And sometimes that prevents the full processing of the event, causing the memory gaps. Therefore, with all of the information that I've just mentioned, we still don't really know the long-term effects. We kind of have seen a lot of research of that immediate effect of the traumatic event, but we haven't really seen the cognitive processing along with the memory loss and even a potential recovery of your memory over time. So I propose a study that really investigates the relationship between trauma, memory consolidation, and that cognitive functioning. And since we've only seen really short-term and small sample size, I'd want to do a longitudinal study that would specifically determine how trauma impacts memory functioning over a traumatic event and how it impacts like memory over a long time. And then also I would want to kind of dive deeper into how memory processes might be more severely affected by other people and not by some. So I think that seeing what those factors are, we'd be able to kind of predict what the memory loss would be in one patient versus another, and that could kind of change how we implement our therapeutic techniques. So first off, I want to make a couple of hypotheses. So first, I think that in the beginning, right after the trauma is experienced, participants will show significant impairments in memory functioning, and specifically in those details of the traumatic event. I expect to see like a higher number of participants reporting gaps or errors in the key events of the trauma. And then I also have another hypothesis that I expect over the long term, participants will show persistent cognitive impairments, and not just things that are related to the traumatic event, but even just everyday functioning and just your cognitive processes on an autobiographical level. And I think that the impairments would have to do with the stress hormone uptake whenever it comes to the traumatic events. Another hypothesis I want to make is I expect that individuals will show improvement of their memory if they are implementing these therapeutic techniques, and if they're kind of processing the memories of the traumatic event that they experienced. Therefore, how I would set this up is I would start with it being specifically a longitudinal study that looks at 200 participants over the span of a 12-month period. And all participants' ages would range from age 18 to age 45, and they would consist of individuals that have experienced different kinds of trauma, that's childhood abuse, the combat, natural disasters, or others. And then I would split each of my participants into 3 groups. I would have group 1 be people who would have diagnosed PTSD from these different things. And then I would have a group 2 that is not diagnosed with PTSD, but they do have some kind of really important one-event traumatic experience. And then group 3 would be that control group, just kind of the group that doesn't have any experience with trauma of a significant level. And then after I have my participants, how I would kind of assess them for that, for what I'm trying to accomplish. I would use, to assess them for cognitive functioning, I would use the Wechsler Memory Scale and the Mini Mental State Examination. I saw these 2 specific tests that were done on a PubMed article that I listed, and it'll be to ensure that any cognitive disruptions are due to the trauma and not any preconceived diagnoses. Then to assess memory disruptions, I will use self-report questionnaires, neuroimaging, and cognitive tests. The self-report questionnaires would be the post-traumatic stress disorder checklist and this dissociative experience scale that will be used to measure the memory defects. And then neuroimaging, such as the fMRI, will be used to observe changes in the hippocampus, the amygdala, and the prefrontal cortex, which are all associated with memory, tasks, and cognitive functioning. And then the cognitive tests will focus on that autobiographical memory and your working memory. And those will be given at the baseline, 6-month, and 12-month intervals. So to first really begin the study, I would start with the initial assessment that will include like the clinical interviews, getting to know the patient and their trauma-related experience, and really understand the severity of their symptoms and how that has impacted their memory loss or their cognitive functioning. And then the trauma exposure assessment would be conducted, and participants would be asked to describe their traumatic events in detail and then perform memory tests associated with the traumatic events. Then I would also ask them to recall not just something doing with their trauma, but also everyday memories to assess just their general memory functioning, so we could kind of subtract that as a baseline. And then I would do the follow-up assessments that will be conducted after the 12 months is over. They will complete a series of cognitive tests and the self-report questionnaires that I mentioned before, and that will be at the 2 6-month intervals. And then after the 12 months are over, I will complete a follow-up interview about their experience with memory disruptions and even a potential recovery of their memory. Finally, after all of this, at the beginning of the process, I mentioned getting that baseline, and that would include the neuroimaging of an MRI scan, looking at those specific brain parts that have to do and could be affected by memory loss. And then also brain activity at the end. So just trying to get that initial and that final. In conclusion, I really wanted to conduct this study just so we have that deeper understanding of the long-term effects of memory processing and cognitive functioning related to trauma. It will allow us to determine even the factors that contribute to the recovery of memory over that time. And by determining these different factors, the biological and cognitive processes and mechanisms behind the trauma-induced memory loss, we'll be able to implement new therapy tactics that will really support these individuals and make a difference in their well-being and their cognitive functioning over time. So yeah, thank you for listening, and I hope to really implement some of my ideas and really conduct even further research along these mechanisms.